Good morning, everyone. I'm going to talk about program problems. As you can see in the slide, our program objective is Healthy People 2030, increase the amount of adults who do enough aerobic and the muscle strengthening activity in the Lynchburg, Virginia. So the problem is only 34% of adults meet CDC recommendation for physical activity, and that means two-thirds of our population are not getting the movement they need for the optimal health. And 40% of residential report that their neighborhood do not support physical activity. And this could mean a lack of sidewalk, park, lighting, or a safe space of exercise. And on average, adult exercise 4.5 physical unhealthy days per month, which can impact a productivity, well-being, and healthcare cost. And even more concerning, there are the six poor mental health days per month, which is reported. And physical inactivity is often linked to the mental health struggles. So this is a critical intersection. So this is all about the problem. In this slide, I'm going to talk about the implementation strategy and the core connection of the program. So, the first connection with the partnership and resources. So, the program is collaborate with the local churches, YMCS, and the Liberty University, Lahe Fitness Center for the space, equipment, and instructors. And the second connection with the participant requirement using cost effective method like flyers, news articles, social media, or word of the mouth to reach a Lynchburg City adults. And the third connection with the education and the community awareness provide a ongoing participant education about local social resources, community events, and the opportunities for the engagement and the social connection and the well-being. Dedicated time before and after exercise, classes for the socializing, foster relationship, reducing isolation, and enhancing mental health.
Core Connections' mission is to promote the health and well being of Lynchburg City adults by implementing group focused physical activity classes among local organizations within the community. Our overarching goals include reducing social isolation and increasing physical activity in Lynchburg City adults. Objectives of the program include conducting 5 group exercise classes a week over a 12-week cycle. For a behavioral objective, by the end of each 12-week cycle, we would like to see at least 80% of program participants reporting an increase in social interactions with others, including fellow program participants, as measured by program surveys that we will administer. Our outcome objective looks to reduce the number of poor mental health days reported in the last 30 days by 50% among Lynchburg City adults by 2030, as measured by county health ranking statistics. As previously stated, the target population of Core Connections includes adults 18 years of age and older in Lynchburg City, Virginia. Our target marketing audience includes adults 30 to 50 years of age, those with low to middle income households, and individuals with poor physical and mental health. The product aspect of our program includes our 5 group style exercise classes per week, educational deliverables that includes information on physical activity routines, nutrition, and even community resources. And the program will also offer childcare services for additional accommodation for the participants. For price, the program will require $20,000 per program period start date for program operations. Recruitment costs will include incentives for participants, including t shirts, pedometers, resistance bands, etc. Personnel will include our certified personal trainers to teach the classes, and then we have to also account for unforeseen costs. Our grants that we look to obtain will mainly come from the Greater Lynchburg Community Foundation, and any donations we receive will be both monetary and in kind. The program and exercise classes will be held in churches in Lynchburg City, Virginia, as it is a cost effective space. And regarding promotional of aspects of the program, we will plan to use multi channel, accessible, and community centered approaches, which includes in class communication, take home and digital resources, community and environmental communication, and feedback. Input resources for Core Connections includes equipment, which will mainly come from in-kind donations from local YMCAs or other community donors. We will also need marketing resources and incentives, as previously discussed. Personnel is also an input we will need, including certified trainers to lead the exercise programs and educated program coordinators to create educational deliverables for participants. Our outputs include the exercise classes that will be held at two local Lynchburg City churches. On Tuesdays and Thursdays, we will focus on aerobic and muscle strengthening, and on Saturdays, it will be more aerobic focused.
Our program is rooted in health behavior theory, specifically social cognitive theory, which holds that there are 5 constructs that affect health behavior: knowledge, perceived self efficacy, outcome expectations, goal formation, and social structure. We address each of these constructs in our program. For knowledge, we provide both procedural and content knowledge through in class instruction and modeling and take home educational deliverables. Perceived self efficacy is impacted by the factors of physiological state, social persuasion, vicarious experience, and enactive attainment, all of which are addressed in our program through the use of a group setting, modeling, and experiential learning. Outcome expectations reflect what a participant can expect to gain from the program, which we help shape by providing educational deliverables. Goal formation breaks the larger outcomes into smaller, achievable steps, which we do by encouraging participants to show up for 3 classes each week, a much more achievable goal than the entire program at one time. And finally, Core Connections helps provide social structure by meeting in a physical location and encouraging people to come together and exercise, removing some of the barriers that would prevent people from exercising. Because we want this program to continue on, sustainability is a priority for us. We rely heavily on volunteers and our community partners, so it is important to us to continue recruiting and retaining volunteers and building strong partnerships with other resources in the community. We also do need funding to continue running, and we will continue seeking funding from our current grant sources while also applying for new grants. The implications of this program are both community focused and far reaching. In our immediate community, we hope to see improved physical health and social connection, which can lead to an overall greater sense of belonging. We may also see an increase in church attendance as we are partnering with churches and utilizing their spaces. Further than just Lynchburg, if this program is successful, we could expand into surrounding communities and implement core connections there. Core Connections can also serve as a model for future programs. And finally, the data collected during this program can be used to influence policies and advocate for better access to community resources. Because we are working with people, there are a few ethical considerations to be discussed. First is confidentiality, which will be done through multi-factor authentication for attendance and documentation records to keep our data secure. Participants will also be assigned an ID number for all documentation purposes, which will be stored separately from the data collected. Another consideration is HIPAA compliance, which we will maintain by requiring all staff and volunteers to complete a mandatory training before they can work with us.
I know you have heard a little bit about our program so far. So let me tell you how to get involved and what your role would look like. So we have 2 main groups of stakeholders, internal and external. Internal includes our management team, employees, and volunteers. The internal group is specifically tasked with the day-to-day operations and strategic decision making. External groups include program participants and families of the participants, funders, suppliers, advocates, the community, and government. Grouping stakeholders, you all, into categories helps ensure appropriate management, communication, and strategic alignment based on commonalities, such as interest and influence. We would love for you all to be involved in multiple ways, and some of the ways we could use your help is with the securing of resources, such as exercise equipment, providing input and direction moving forward, and supporting, advocating, and communicating within the program. We also acknowledge that each of you and your organization have unique contributions, so we would love to hear how you could best help Core Connections to flourish. As stakeholders, I also understand the value in having tangible measurement tools and subsequent data. An example of our evaluation strategy is on the screen. It has our program objective. By the end of each 12-week cycle, at least 80% of program participants will report increased awareness of at least one community resource or social connection opportunity. Our evaluation question for that objective is how many participants can identify at least one community resource or opportunity for social connection. Our indicator is the identification of resources and opportunities for social interaction in the community. And our data collection strategy for that objective includes program surveys at the end of each cycle. For each program objective, we have the specific evaluation question or questions, indicators, and data collection strategies. Please let us know if you would like the full list and we can provide that to you. Here's our timeline. It begins in August 2025 and ends in July of 2026. The full planning phase occurs from August 2025 until February of 2026. We have already completed main activities in the planning phase, such as creating a logic model and developing an intervention and implementation plan. We are currently in the beginning of December 2025, which means we are in the middle of our interim phase. At this time, we are looking to continue to build a website, recruit and train volunteers and instructors, and recruit participants as well. In the coming months, we hope to begin intervention delivery around February of 2026, and following intervention implementation, evaluation will begin in April of 2026. Here are our references, and we thank you so much for listening. We would love to have your support and expertise, and we look forward to our future partnerships.